Welcome to this educational video about gastroenteritis, commonly known as the stomach flu. We'll explore what it is, what causes it, how it affects your body, and how to manage and prevent it. This video is for informational purposes only and should not substitute professional medical advice. Always consult a healthcare provider for diagnosis and treatment. Gastroenteritis is most commonly caused by viral infections. Norovirus and rotavirus are major culprits, particularly in adults and children respectively. Bacterial infections, such as those caused by Salmonella, E. coli, Campylobacter, and Shigella, can also lead to gastroenteritis, usually through contaminated food or water. Less frequently, parasites like Giardia lamblia and Cryptosporidium parvum can be the cause. Certain medications like some antibiotics and NSAIDs and underlying medical conditions can also trigger gastroenteritis-like symptoms. When a virus, bacteria, or parasite enters your digestive system, it inflames the lining of your stomach and intestines. This inflammation disrupts the normal absorption of fluids and electrolytes, leading to diarrhea. The irritated stomach can also cause nausea and vomiting. The body responds with increased intestinal motility, further contributing to diarrhea. Damage to the intestinal lining may reduce lactose absorption, leading to temporary lactose intolerance and exacerbating symptoms. Gastroenteritis is a widespread illness, affecting people of all ages worldwide. Viral gastroenteritis, especially norovirus, often occurs in outbreaks in close quarters environments like schools, nursing homes, and cruise ships. Rotavirus is a leading cause of gastroenteritis in infants and young children, although vaccination has significantly reduced its incidence. Bacterial gastroenteritis is often linked to foodborne outbreaks, with the prevalence varying depending on food safety practices and sanitation standards in different regions. The primary symptoms of gastroenteritis include diarrhea, which can range from mild to severe and often accompanied by abdominal cramps. Nausea and vomiting are also common. Some individuals may experience a low-grade fever, headache, muscle aches, and general malaise. Symptoms typically last from a few hours to several days. Dehydration is a significant concern, especially in infants, young children, and the elderly, so watch out for signs like decreased urination, dry mouth, and dizziness. Diagnosing gastroenteritis usually involves a review of the patient's symptoms and medical history. A physical examination helps assess the level of dehydration and abdominal tenderness. Stool samples may be collected and tested to identify the causative agent, particularly in cases of suspected bacterial or parasitic infections, severe illness, or prolonged symptoms. Blood tests are rarely necessary but can be used to assess electrolyte imbalances and kidney function in severe cases. In most instances, the diagnosis is made clinically based on the characteristic symptoms. While gastroenteritis is often a general term, it can be broadly categorized based on the causative agent. Viral gastroenteritis includes infections like norovirus and rotavirus. Bacterial gastroenteritis includes infections like Salmonella, E. coli, Campylobacter, and Shigella, and parasitic gastroenteritis includes Giardia and Cryptosporidium. Additionally, gastroenteritis can be classified as acute, lasting a few days to weeks, or chronic, where symptoms last longer than 2 weeks. Treatment for gastroenteritis focuses on managing symptoms and preventing dehydration. Oral rehydration solutions containing electrolytes are crucial, especially for children and the elderly. Avoid sugary drinks, as they can worsen diarrhea. Rest is essential to allow your body to recover. Bland foods like crackers, toast, and bananas are generally well tolerated. In severe cases of dehydration, intravenous fluids may be necessary. Antibiotics are only used for bacterial gastroenteritis, and antiemetics may be prescribed to reduce nausea and vomiting, but with caution, especially in children. Avoid antidiarrheal medications without consulting a doctor, as they can sometimes prolong the infection. Preventing gastroenteritis involves practicing good hygiene. Wash your hands frequently and thoroughly with soap and water, especially after using the toilet, before preparing food, and after contact with someone who is ill. Avoid sharing utensils and personal items. Ensure food is properly cooked and stored at safe temperatures to prevent bacterial growth. Drink safe and clean water. Consider vaccination against rotavirus for infants. If traveling to areas with poor sanitation, be extra cautious about food and water safety. The prognosis for gastroenteritis is generally excellent. Most people recover fully within a few days to a week with supportive care and proper hydration. Complications, such as severe dehydration, electrolyte imbalances, and kidney failure, are rare but can be serious, especially in vulnerable populations. Research continues on developing new vaccines and treatments for specific viral and bacterial causes of gastroenteritis, as well as improved strategies for managing dehydration and preventing outbreaks. Scientists are also exploring the role of the gut microbiome in gastroenteritis and its potential for therapeutic interventions.